Yes, yes. Good morning. Welcome to Tuesday of Democracy Days. Day one went really, really well, and I look forward to the program today. We'll get started with the 10 o'clock panel in just a moment. The sign-in sheet for anyone whose attendance needs to be recorded is being passed around the room, and I'm also just going to kind of place it over there in case you need to sign in afterwards if you didn't get a chance to do that right now. Please be aware, take a look at your program regarding yesterday's Afghanistan panel. The reason I ask you to look at that is that there's a sidebar on a donation drive having to do with our partnership with the International Institute of St. Louis and incoming refugees from Afghanistan. We're gathering certain supplies. There's a list that you can look at, and we ask that you take part in that. The Afghanistan panel was outstanding, so anybody who wants to get, some great perspective from an Afghan who's lived in the United States for 30 years, a military veteran, and one of our economics professors. It was just an outstanding panel. Unfortunately, with it being at 2:30 in the afternoon, attendance was down, but we do have the video, stchaz.edu/democracy days. And so please take a look at that donation drive. We've got probably, according to what I've heard, about 1,000 Afghans coming to St. Louis, and they need some support, so we can step in on that. We'll get started, as I say, in just a moment. Thanks for being here.
Reverend, good morning. Today we're going to be discussing Medicaid expansion here in the state of Missouri, and we're very lucky to have a state representative here with us to help discuss this topic, Trish Gunby. She represents, which district number is it?
I'm the 99th district, which includes Manchester, Valley Park, Twin Oaks, unincorporated St. Louis County.
And you're in Baldwin right now, right?
I am.
Yeah.
Manchester, yeah.
Manchester, pardon me.
Right.
Okay.
About 30-minute drive.
And she was elected in a special election in 2019. She's a Democrat, represents that district. And she's also, it's exciting because she's also going to be a congressional candidate this coming year. She's going to be running for a U.S. seat in the U.S. House of Representatives in the 2nd District, which, depending on where you live, it covers part of St. Louis County, so that may well be your district as well. And so I wanted to start off here talking about Medicaid in general, and I thought we could have a conversation about what Medicaid does generally and why it was set up.
Well, Medicaid is called Missouri Health Net here in the state, and so if you Google that, that's where folks, typically low-income folks, pregnant women, parents with children, disabled individuals, seniors who have lower incomes can access health care, and that's what we call it here in Missouri.
Right, and so this was set up initially, I think in the 1960s, to help primarily children born into poorer families and pregnant women who are disadvantaged as well, so it could get them some basic care.
Right, basic care, checkups, preventative care, that sort of thing.
Right, and that's the program and the way it was set up in the U.S. until 2010, when the Affordable Health Care Act was passed, which is also known as Obamacare commonly. And that expanded it, and you might know a little bit more about this than I do, but it expanded it here in Missouri to cover a much wider group of people.
Right.
Than initially was done.
Right. Are you talking about the expansion just passed?
Yeah.
So expanded Medicaid expansion, we are one of 39 states that has done that now. And so what that means is that it's changing the tiers, the income tiers, and so and also including individuals who are single who aren't tied to children, basically,
right.
Can also access it. Lower incomes of about $18,000 a year or up to $36,000 for a family of 4. And so that population between here in Missouri, 230,000 to 275,000 individuals who were unable to access health care because they didn't make, they made such less money on the low end of the scale to qualify for Medicaid. They couldn't qualify for that because they didn't make lower amounts of income, but they couldn't afford, because of their jobs, that sort of thing, they couldn't afford to access private health care. So there was this gap of 275,000 individuals, and by passing Medicaid expansion, they now have access to health care, preventative health care, because we all know that if you do need health care and you don't have insurance, you still end up in emergency rooms, urgent care centers, those kinds of things. So we ultimately pay for it, but it's not really a preventative kind of health care.
Right. And the Democratic Party of Missouri, I don't ask you to speak for all Democrats, but I think yourself and the Democratic Party of Missouri generally strongly favor this idea of expanding Medicaid, right?
Correct, yes.
Yeah. And we were going to have another state rep here today, John Weiman, who represents this district, but he had a meeting he had to go to today and had to cancel out sort of last minute. So I'm not once again going to speak for the Republican Party of Missouri, but I wanted to mention that there was a lot of opposition to expanding Medicaid, and this is before we even had the vote in 2020. There was a lot of opposition in the Republican Party here in Missouri to expanding Medicaid, and some people in the Missouri State Legislature felt that we couldn't afford it, that it wasn't something we could afford under the state budget the way it is right now. And there was also, I think, a deeper ideological objection to expanding Medicaid, in that whether this position is right or wrong, a lot of people compared it to welfare in general, and they were afraid it was going to advantage, it was going to spend taxpayer money on people who intentionally were not working or just trying to take advantage of the system. And that was one of the big objections to it when it was proposed here in Missouri. Because under this, the Affordable Care Act that was passed in 2010, every state had the option to expand Medicaid the way Representative Gumby put it, to cover more people than was initially covered. It wouldn't just cover pregnant women or children any longer, but lower income individuals in general. And Missouri for years had, let's say, declined to do that through the legislative process. And then in 2020, last year, there was a big drive here in Missouri to go out and collect signatures and put this issue to a vote of the people, which we can change our Missouri Constitution that way through a popular vote, through a voter initiative. And that was on the ballot in August of 2020. And I was going to put a question to you. Why do you think they put that on the 2020 August ballot rather than on the main ballot in November? I don't know if you had any opinions on that, or if you want to talk about that.
Well, if we can just, and I'd like to talk about the initiative petition process in general. Yeah. The thing I think that's unique about this issue and others that voters have voted on and added to our Constitution is that it's led by citizens. It's the initiative petition process. You file that with the Secretary of State. You collect signatures around the state. And it's a very time-consuming and labor-intensive process. And so citizens were really the ones who got this on the ballot. It was not something that the legislature decided to do. So understand that you have the ability to do that. If you believe in a certain issue, you can get that on the ballot. I do want to also lift up, though, that there is legislation, we heard some last year, I think it will come back this year, that would affect that process and make it actually more difficult to get things on the ballot. And by difficult, I mean requiring potentially more signatures around the state, but also charging per page or by signature. So if you're a grassroots group and you have an issue that you want to get on the ballot and you collect enough signatures, you would then be asked to potentially pay per signature or per page. And you typically don't have that kind of money. So I would invite you to follow legislation in the upcoming session, because that process, which has boded well for the state of Missouri, I believe, and obviously Medicaid expansion is one of the things that has now passed, that I believe is under attack, and I don't think we should have to charge for getting things on the ballot. So just wanted to lift that up. Anyway, it got on the ballot, and I think it was not included in the November election because many times you move certain issues to lesser elections when not as many people might vote. And certainly in August, early August is a tough time to get people to vote because they're on vacation, they're doing things with their families, finishing up, buying things for school. And so I think that was intentional, that it was put at that time. In any case, it still passed. 53% of the state voted for Medicaid expansion. And in fact, I was on a Zoom call yesterday, and following its expansion and the Missouri Supreme Court decision that we have to enforce it, the poll suggested that 62% of Missourians now approve of Medicaid expansion.
And that was an interesting point you brought up about some of the legislation that's been introduced to try to make it more difficult to do voter initiatives, to put some more, I don't say roadblocks there, but make it certainly more difficult to accomplish. In that, and I think this is a fairly objective statement, that the Republican Party of Missouri is not crazy about this initiative process because it's been used by more progressive elements in the state of Missouri to pass legislation they didn't want passed. And those of you who take my class on state and local government, we've mentioned this a bit already, right? That things like medical marijuana legalization, raising the minimum wage, getting rid of right-to-work laws, and now Medicaid expansion were all done through this initiative process. These are bills that never would have been passed by the state legislature because it's a very conservative state legislature right now. And so there's been this move to try to make it more difficult to get things on the ballot like this. And you could probably tell me, where are those right now in the state legislature? They look like they're progressing, because I'd heard about them, but I didn't know like what the status was.
I know that the elections committee has met through our our off season. We're in session early January to mid-May, and but there are some committees that meet throughout the rest of the year, and they have been meeting. I know we heard that legislation. It went through committee, and we heard it last year. It didn't make it across the finish line, but I think it'll come back.
It'll come up again later.
I would imagine so.
I can picture that.
And one thing I want everybody to know, if you can't, the thing that's great about our legislature and our General Assembly is if you can make a trip out to Jeff City when we're in session and sit through committees, you can provide testimony, you can sit in and watch our chamber sessions. But the other thing that started up because of COVID is you are now able to provide online testimony. There's an online form, so you don't have to make that trip. And you can watch hearings and you can watch chamber sessions online. So before, it's a 2-hour drive or so, maybe an hour and a half from here. And that can be difficult for some, but I would invite you to follow along when we're in session and then respond to your rep and your state senator and the governor if you agree or disagree with, what we're doing basically.
And so moving back up to, we get to August of 2020, and it passes with, I can't remember, 52 or...
Yeah, close to 53%.
53% of the vote.
Right.
So the majority of people who take part in this vote in August of 2020 vote to expand it. And this is where things get legally and politically really interesting, because the voters have passed this, and they've instructed the state of Missouri, they've added something to our state constitution that says we should expand Medicaid. But then it gets to the state legislature in Jefferson City, and I'll let you pick this back up. What happens at that point?
Well, I assumed, and I think most people who voted for Medicaid expansion assumed that it would be funded, because you typically, I don't think you vote for things and think that it's not going to happen. I think you vote assuming it's going to happen. Mm-hmm. And so the argument on the House floor when we were trying to fund it in our budget was that there was no funding mechanism in the legislation. And so obviously that was a lot of heated debates around that on a partisan basis. Republicans felt like it wasn't funded. Democrats felt like it had to be funded. We had money in reserves in the budget. In fact, Governor Parson, who was not a proponent of Medicaid expansion, but when it passed, he put it in his budget. And so that was the discussion on the House floor, was the fact that, are we undoing the vote of the people, which to me feels pretty undemocratic. And so, I heard some of my colleagues talk about that they know better, and people didn't understand what they were voting for. So those are the kind of things you really need to pay attention to, because obviously I'm a firm believer if we vote on something, then we need to follow through with it. So those were the arguments that played out on the House floor in Budget Committee. And what we found out was The Missouri Supreme Court this past summer in July voted unanimously, and it's a primarily Republican-appointed court, voted unanimously that we had to, in fact, expand Medicaid. So that's what they're in the process of doing now, is figuring out the systems for that, but knowing that it should have started July 1st, but because it went through the courts and it wasn't funded when we were in session, it's now not going to be active until October 1st. So those individuals who could have accessed care from July to October have been without care because we have to get the systems, the computer systems and signups up and running. So that's unfortunate.
And I was going to ask about that a little because I know right now that they've delayed taking applications until, like you said, October, I believe. So it's a delay, and then we'll see what happens at that point.
Right, and they will. You can go ahead and apply. You're probably not going to hear back, but things will be retroactive. Mm-hmm. But certainly, if you're in an emergency room, you can't plan those kinds of things. So, some health care may be retroactive. Much health care is not. You just need help when you need it. So.
And with that, I was also going to ask, I'm not sure where this is right now, so the Missouri Supreme Court says you have to fund this. Mm-hmm. Is this something that the governor is going to do, or is the legislature going to get back together and try to figure out where to, allocate this money from?
Right. Yeah, it will get funded. Budget is meeting as well right now. The thing about Medicaid expansion is when you expand it, the federal government assists you in that effort. It's not something that the state has to come up with all the money by themselves, by yourself. And we have American Rescue Plans funding that we got from the American Rescue Plan, and so upwards of $1 billion. And so that money is available, and in fact, states are rewarded for expanding Medicaid, encouraged to do so. And so you have to come up with typically 90% the federal government funds, and then the state comes up with 10%. But what we found is in states that have in fact expanded Medicaid is that once people are able to access the system, you provide jobs to people, rural healthcare centers and hospitals stay open, and so it helps those areas that don't have access to health care. People aren't having to travel into urban areas, and it provides jobs for people. And so over time, it's really more of a break even, or you actually kind of come out ahead. So the argument that we're going to lose money in doing that really has not played out in other states that have expanded the program.
And so, was there anything else you wanted to talk about Medicaid expansion right now before we turn it over to questions here from the audience?
I would just say, I want you to be mindful of this process and understand that, as Gabe said, this was something that citizens decided was important for its residents in the state of Missouri. Went through the effort to get it on the ballot. It was voted, 53% of Missourians voted for it. And so when I see what played out this last session with the legislature sort of flexing their muscles and saying, we know better and we're not going to do what you told us to do, I think you just need to pay attention to that. Find out look up your legislator and see how he or she voted on this issue, because those are things that are concerning to me. I may not agree with the way votes land, but I have to live with how that plays out. And anytime you have elected officials going against the vote of the people, that's concerning on a bigger issue. And that's really one of the first times I can think of that we've really seen that happen. Mm-hmm. And thankfully the courts decided in our favor, but it can set a precedent. And so that is concerning to me, certainly as a citizen, but also as a legislator.
And at this point, there's a great discussion about Medicaid. I wanted to open up the floor to questions here from students, anybody else who's here, so we can talk to Representative Gunby about Medicaid expansion in particular. And also, I would say we've got a state representative here who's very knowledgeable about what's going on in Jefferson City, and general questions I think would be appropriate as well.
Hi, yes, thank you for coming. I was really disappointed we didn't have our your Republican colleague here, because I think it would have been one of my goals for coming here was hearing a give and take on why is it good, what's good, what's bad about Medicaid expansion, because there's always different perspectives. And I'm just very disappointed that, I mean, not that you're chopped liver, but I just, but can you then explain your best case for why this is so important? Why Medicaid, I assume that was kind of the goal, why Medicaid expansion is so important for Missouri.
Right. Well, and I wish that there was a counterpoint as well, because I'd be curious to hear more about that. And there perhaps in that, that my Republican colleagues, there might be people who are kind of all over the place, in regards to that. Some that are very strongly opposed and others that are more moderate in their thinking. So I would have appreciated hearing that too, but especially hearing now that the courts have decided that we have to do it. My case is, I guess we have to decide as a state, as a country, do we believe that everybody should have access to health care? I think, to me, that's the overarching question. We obviously had Medicaid, which provided for the most vulnerable, very low income, and I think the myth that was pushed with Medicaid expansion is that these individuals were not working. These were people, or are people, who have jobs, have minimum wage jobs, fast food workers. All those hiring signs you see right now, those are folks who really are on the front lines and are in contact with the public, and we all know what's happening with COVID, masks or no masks, vaccine or no vaccine. So they're front and center serving us, and they're vulnerable in that if they get sick and they go home, they then do not have a way to pay for their health care. And if you get sick and you can't provide rent for your apartment, or you can't buy food to feed your family, what are you going to do? That if you get sick and you don't have health care and you make $30,000 a year and it's you and your child, how are you going to survive? What does that look like? And so, to me, that's the bigger story. Do we really believe that these individuals should have access to health care? Or could they possibly be bankrupted? I know we're all on social media. Do we pay for our health care through GoFundMe accounts? I mean, that's really the bigger question. And so I don't believe that that's the way to get adequate health care, is to set up a GoFundMe account. And to worry that if I go into work today and I get sick and I go home and I take that back to my family, then I'm the primary breadwinner. How am I going to pay to keep my food on the table, a roof over my head, and pay for my health care that's going to land me in an emergency room? So for me, it's, I obviously believe everybody deserves health care. And I think there's a more efficient way to do that. And that's not the purpose of this discussion. But that's what we really have to decide as a country and as a state. Do we believe everybody should have access to health care? And if so, how do we pay for that? Because the way we're going about it now, folks can't wait to get to be 65. I mean, everybody wants to be 65. It's the new, 45 maybe. But everybody wants that, because when you're 65 and you get Medicare, you have one card. I took my mom to the doctor yesterday. She owed nothing when she checked out. She had one card, done, no bill. So when you go through health care now, if you have an episode that lands you in the hospital and you're paying, for hospital stays and anesthesiologists and surgeons and every pill and the Kleenex you use, and then you go home to all these bills and you talk with your insurance company and who's going to pay what, it's time consuming, it's not efficient, it doesn't work. It is not working effectively. And so that's a bigger discussion that we have to have.
And as we were, just to interject a little, since we don't have the other side of the panel here, I was going to say that, yeah, there's an ideological debate that's going on in the U.S., and it has been going on for decades now, about whether government needs to make sure that everybody in our country has access to quality health care. And some people argue that as prosperous and wealthy as our nation is, we can afford that and we should do so. Conservatives generally argue that health care is done more effectively through the free market. And therefore, government should not get too involved in this or expand Medicaid to cover more and more people. We should instead let people get health care coverage through private insurance that they get usually through their employers. And that's their solution usually, that they believe that's a more effective way to deliver health care. But just to illustrate that idea. Yeah.
But if you, but if you are somebody working at a fast food restaurant, you can't afford that private health care. And that's the challenge is, it may be available, but you don't have the funds. So what do we do with those individuals? And Medicaid expansion kind of provides that.
You know, I'll come out of the closet here and say I'm a liberal myself, so I'm not one to really argue the free market approach terribly when it comes to health care, but I didn't want to at least, throw the idea out, right? Yeah.
No.
May I ask a contextual question? Because, and you've gone almost into this area, the mission statement of Democracy Days is to examine the history, health, and functioning of democracy in America and abroad. I'd like you to comment specifically on the democracy, the health and the functioning of democracy, because I was very glad that this panel was scheduled, because I think it's audacious for any elected official to say, okay, here's the will of the people, but we're not going to do that. To me, that is less a matter of being represented than being ruled. And how can we tell people, yes, as we do, take part in the system, get out there and register to vote, and then inform yourself, get out there and vote, and contact your elected officials, and take part in the system? What about those people who put together that ballot only to have Missouri Republicans say, we know better? So I guess maybe I'm answering my own question, but I'd like, first of all, when else has this been done where it's just so overtly the case, here's the will of the people, and here's politicians saying, never mind?
There's been a couple of instances of this happening recently in the U.S. I think it was in one of the Dakotas, the voters legalized recreational marijuana, and the governor was basically openly trying to find ways to get around that. And I know some people in the state legislature here in Missouri, some Republican members, pointed out, and this is true, that we live in what's called a democratic republic, which means we elect elected representatives who are supposed to represent our interests, and they're the ones who make the decisions. Some of them were brave enough to say, yeah, well, the truth is our state legislators probably know more about Medicaid expansion than the average person, which, when you're running for re-election and you're trusting on the people to vote for you, is kind of a bold argument to make, I would say, although one that's not completely unfounded in logic. That we do elect our state legislators, and they're the ones who are supposed to be running the government in a lot of cases. Although, of course, here in Missouri, we do have a voter initiative process.
Well, and what I would say around that is, if that is your position, then you need to be willing to have a town hall or some event or something where you invite people in and say, I understand that this is what happened, but let me explain to you why I'm going to vote this way or why I believe as I do. And I think that is the piece that is missing. It's very comfortable, and I'm in the super minority. There are 49 of us out of 163. So as a Democrat, there are certain issues that we are needed because there may be a faction that doesn't vote in line with the Republican Party. So Democrats are needed to push certain legislation through. Gas tax, for example. We were needed for that to pass. So there's a comfort level when you're in a majority position, and this just, even not being an elected official, even in a friend group, say for instance, if everybody agrees with you for the most part, or the majority, to stand up and say what you believe, and you're in a safe place to do that. It's another thing to go in front of people and to have to argue your position knowing that there's people in the audience who don't agree with you. And so if you're going to do that and go against the vote of the people, you better have a really good argument why that is. And you better be okay with explaining that to people and answering those questions. And for me, that's what is lost in all of this, is I don't feel like my colleagues across the aisle have put themselves in situations to explain their position. They're very good doing it on the House floor. And then as Democrats, we are what they call PQ'd, where they quit debate and we can't talk anymore. And then we put it to a vote that we know we're going to lose because we're in the minority. But when you're in a town hall setting, you can't PQ your constituents. Or if you do, you shouldn't be elected. I mean, everybody's not going to agree with you. So you better be able to explain your position. And that, to me, is what's concerning in all of this, is explaining positions in front of audiences that you cannot control, basically.
Thank you.
Yes, thank you very much for coming. We appreciate a lot of good information, especially town hall. But I was in the legislature in the 90s, from 1992 to 2000, and I was on the Social Services Committee, and welfare was a big deal. Matter of fact, welfare is the largest portion of the Missouri budget. Since we have Medicaid expansion, which I support, and I'm a Republican, the problem is, now this is 25 years ago, I hope it's changed, or maybe you as a senator can do something about this. We have the doctors are getting out of Medicaid for one reason. The state takes 16 to 18 months to pay them. Back in 25 years ago, citizens from St. Louis who were in Medicaid had to go to Rolla, Missouri to get their dental care. And they sent them there by taxi, not by van, but by taxi, from St. Louis to Rolla. So if we're going to have expansion, which is good, we need more doctors, and the only way we can get more doctors is for Missouri to find a way to get those bills that these doctors send to Missouri, get them paid, because with this expansion, we're needing more doctors, and these doctors are saying, I'm not going to wait 18 months to get paid. So I hope you can work on that, because if we expand it, we need expanded doctor services. And we need a lot more services, especially in St. Louis and Kansas City, where the largest number of people in need are located.
Well, and even help, in terms of recruiting doctors in general, my husband's a physician, an internist, my daughter's a nurse. They have been on the front lines the last 18 months, and frankly, in some instances, have been under attack for their positions around the virus and everything. And so just the idea of public health and what that looks like and how we interface with people we perceive to be experts on things, it's hard to recruit people to want to do that, because they're obviously wanting to care for patients and have that interaction and make people better. And what we're seeing now in our country, not just in healthcare, but in a lot of different spheres, is we're seeing people being attacked for their positions on things and their expertise. And so I think you're going to look at, in terms of healthcare professionals, public school teachers, everybody, people who are out in the public sphere, and we all feel like, we have a part of them, we pay your salaries, those kinds of things. We're going to have to really think about how we interact with those individuals. My husband now, he's been practicing 30 years, and everything used to be in a folder. He'd bring home charts in a folder. Everything's online now. Now people can email him. And so when you're looking at trying to find doctors who will move to rural areas to serve that population, and truly it's a 24/7 job, people burn out around that. And to your point about not getting paid promptly, but also feeling like you're on call 24/7. It never stops. He works, he leaves for work at 6:45 in the morning, he gets home at 8 at night, we eat dinner, and he goes back on his computer till 11 at night, 5 days a week. That is his job. How do we recruit people to be healthcare professionals when we now have this sense of, you need to get back to me when I want you to get back to me, and you need to be responsive. And then when they respond, we don't like what they say. And then we argue with them. I mean, we really have to think about how we are treating those people that we have put our, our health and our well-being, how we treat them. So that's a personal note on my family. Sorry about that.
Let's hear from a student.
Again, thank you for coming. And I know there was no funding put into it, but if there was funding put into it, do you think it would have gone over better with the Republicans in the state legislature? Or do you think the people, like the citizens of this, the voters, would not have passed it?
Well, I think the idea that there wasn't a funding mechanism, I think that was just a way to politicize the issue. I don't think anybody thought that it wouldn't get funded. I think that once it passed, it was just a way to say, we don't believe in servicing this population and we're not going to pay for it. And they got to figure it out on their own. So I think, when you politicize health care, again, I can't wrap my head around that. I probably have some of the best health care. My husband works for BJC. I mean, we have access, but I am mindful of the fact, and I live with somebody who can diagnose me. He can't call in prescriptions for me, but he can diagnose me. But I'm mindful, every time I get sick or my kids got sick, what do people do who don't have access? And so I just try to imagine a parent with a child who's just worked 12 hours a day, rode the bus to work, picked up their child from childcare from a family member or friend, something happens, and having to worry, do I take my child or me to get health care, but how am I going to pay for it? I don't have money to do it, so I'm not going to do it. I'm going to suffer through. I mean, I think about that every time. It's easy for me, and I'm mindful of that, believe me, because I know many are not. So I don't even understand that argument. To me, it's not saying you're not going to fund it. It's just saying you don't care about that population, because we have money. We have money. It's in reserves. The governor put it in his budget. It's there. So to me, individuals have just said, these individuals don't matter. That's what that tells me.
Hey, I'm looking to the back of the bus. Anybody on that back row? There's a lot of brains back there. I want to hear a question from somebody in that back section.
The questions about Medicaid or work in the state legislature in general are great here. So,
what would you like to see on the ballot? And what would you be willing to organize for? Maybe that's a general question. All right. Oh, I'm sorry. I thought I saw a hand gesture. Nobody? All right. Anybody?
How many future legislators do we have here in the room? In the room.
I just have a follow-up to the question earlier about line items and budgets. Don't most bills been proposed or on ballot initiatives have an expected cost on the ballot initiative? So wasn't there a projection cost already on there, or on the Medicaid expansion? Usually they do.
In the ballot language?
Yeah. Usually there's a summary that this will cost X million or whatever. Typically they have that. I don't know if that was in there or not.
I don't recall either, to be honest. I just know that
when they have bills, House and Senate members have bills, there are fiscal notes, but on ballot initiatives, they don't put that on it. In fact, I'm surprised that the courts allowed that bill to even go on the ballot without a funding mechanism, because I was a director of elections in St. Charles County for 16 years, and if the county put on a bill that didn't have a cost or a way to pay for it, I wouldn't put it on the ballot. And the county sent me to court, and I won because the law, the election law says that you have to have a funding mechanism before a bill can go on, or a legislation can go on a ballot, or language can go on a ballot. So I was surprised it even got through. But the Supreme Court handled all that, didn't they?
Yes, they did. Yes, they did. And I think part of it, there was just a precedence that this program has rolled out in a number of states and has been successful. So perhaps there was a little, there was some history behind some of that they felt comfortable in doing so. But I think the funding piece, I think that was an excuse because the government's giving us 90%, and we're expected to come up with the 10%, and over time, it's shown in other states that it is paid for itself, and you've provided care to your citizens. So, but there's an argument around some of that, and I wish Representative Weiman was here, but he is not.
Yeah, I'm just pulling up the budget language. It actually does have budget language in there. State government entities are estimated to have one-time costs of approximately $6.4 million and unknown annual net fiscal impact by 2026, ranging from an increased cost of at least $200 million to savings of $1 billion. So there were cost estimates included in the language. They just didn't have a specific, you will use lottery money, but there was definitely a budget projection in the bill. I don't think very few bills ever have a line item. This money will come from a tax increase on cigarettes, or
right.
But there definitely was a budget projection in the language. So this is wholly specious, this argument, because there was language in there.
Thank you for that clarification.
Thanks, Paul.
Do you know, does Medicaid have dental insurance included in it?
Dental and vision are typically not included.
Do you know why? Because that would be part of, in my opinion, people need glasses. So if you're expanding the funding, shouldn't they expand that to dental and vision?
You know, there are discussions around including dental, vision, expanding that type of coverage along with mental health coverage. You know, you think about a lot of this, you think about physical ailments, you don't think about mental health, and I think we all recognize just in the last few years how mental health has risen to the surface, certainly, you know, coming out of COVID, and that mental health is just as important as physical health. And so I think people are looking at health care in a much more holistic way. It isn't just, you know, I have a pain, excuse me, a pain here, or I cut myself or broke my arm, whatever, a visible ailment. But we have to look at the whole person, and obviously you've got to be able to see, you want to be able to hear. Hearing aids. You know, that is something, as we all age and that population lives longer, should people be able to hear? My mom has a cochlear implant. She went completely deaf. We don't know why. One day she could hear, one day she could not hear. But she had to pay out of pocket for her hearing aids. And my dad was a veteran, so he got his, you know, through the VA. But hearing, everybody with buds in their ears, you know, we didn't grow up having earbuds. So it'll be interesting to see as your generation ages how your hearing is impacted. And will hearing aids be included? Will all those kinds of things that are holistically make you feel better, look better, see better, hear, all those things. But for now, they're sort of parsed out. And in fact, even with Medicare, when you're eligible, you have to buy supplemental insurance that covers additional things. And so, you know, those are bigger conversations just in terms of how we reimagine healthcare in a country that is one of the richest in the world, but we just don't have a handle on how we pay for it and who has access to it, frankly.
And that was an interesting thing in that when you look at private health insurance, it's usually parsed out, like you said, you've got your general health insurance and then vision insurance and dental insurance. Why do we do that? I don't know, to be honest. That's a good question. Why was the system set up like that to start with, where we count those two things as being separate from regular health care? When I agree with you, I think they are, should be on the same thing, yeah.
I don't know.
Do you think that those things will ever be a part of Medicare, like being able to have your glasses paid for or anything else?
I would hope so. This is where your generation comes into play. You can, your grandparents are probably living longer than my grandparents. Your parents are going to live longer. You're going to live longer, hopefully. Although I think we just hit a point maybe where last year or something was like that.
It was down a little bit.
Yeah, it went down a little bit. So, maybe those things weren't included back in the day when they were started because people just weren't living as long. And, hearing aids have certainly improved over the years. And my gosh, they're invisible. You can't even see them. Everything has gotten better, more efficient. And so I think those are things that back in the day, people probably weren't living long enough to even access it. They were wearing glasses probably, but that's certainly something that could happen, and I think that's something that your generation can lead the way on. Those are the things that you should demand, frankly, because you will be accessing them. So I would love to see that happen.
So with this Medicaid expansion, somebody said earlier that it takes up to maybe 18 months for a doctor to get paid. And also the fact, you were talking about your husband earlier saying, how can you expect to recruit people to do this kind of work? It's very stressful and all that stuff. So my question for this is, if we do this, if in the future, do you think the quality of this healthcare will be going down due to the arrangements of maybe how it's set up, like the payments and all that?
This is one of those systems, and anytime, we find it in our taxes and a lot of different things. As things grow, it starts out a certain way, and then you just kind of keep adding on to it. And you get to a point, and it gets to a size that you say, if we were to start this from scratch and it was going to be this big, would we set it up the way it's set up now? And this is probably one of those systems. It started out a certain way, it did its job, and it worked. But as it got bigger and we added things onto it, and every statewide computer system and Medicaid system is a little different. The government gives you direction, but states kind of do things their own way. And so you have the federal government kind of telling you, this is the way we're going to operate with you, but sometimes those groups, the state and the federal government don't interact as cleanly as we'd like them to be, as efficiently. So, there's a reason why this is an ongoing conversation that has not been solved. It's so big, and because it's become politicized and because of term limits, by the time you get up and running and doing something, you're out of office. And when you spend a lot of time just running for office and the money that we go, that goes into campaigns and such, it's the system just is not set up in such a way to make health care as efficient as it could be. And so people are just going to have to try and get on the same page and recognize that in the end, if we provide access to health care across the board, in the end, we will save money and we will save lives. And I'm hopeful that that will happen. Maybe coming out of this pandemic, we're going to reimagine what that looks like. I don't know, but I'm hopeful.
Are there any other questions or comments?
Just wanted to piggyback on the question earlier about Medicare. Congress is right now discussing a multi-trillion-dollar proposal, including expanding Medicare to cover hearing, dental, and vision benefits. I'm assuming you're in favor of that, and maybe perhaps even also Medicaid as well at some point. But What are your thoughts on that?
Well, I just think I am in favor of that. And, you know, people ask how we're going to pay for it. But we pay for all this health care eventually. You know, we just pay for it in an emergency room or under those kinds of circumstances. So much of this is just preventative. And so, you know, I do believe in that. And I believe that like public education, everybody should have access to health care and the same quality health care. I just, you know, that's what I believe. And for those who find themselves in that gap, I can't imagine what that must feel like, especially if you've got a young child that you're trying to, and you're sick or the child's sick, and how you deal with that. So I absolutely am in favor of it. I hope it passes.
When you say that everyone should have access to like healthcare and the same quality of healthcare, do you think that all doctors should accept Medicaid or Medicare?
That's a good one.
Because honestly, not many doctors do, or they do, but it's hard to find doctors now that accept it because of the paying. Because I went to, this is a little personal, but I went to the Walgreens Health Clinic a couple weeks ago, and they would not take the Medicaid because they said they don't pay.
Yeah.
And
I was going to say, we don't, the representative here is not necessarily an expert on all aspects of, you know, like Medicaid, Medicare, and I don't know if this is something you have direct experience with.
Yeah,
but, you
I
know.
mean, I hate hearing that. I mean, that just, I hate hearing that because, again, I think of my own situation and how that would never happen to me. And I don't think that's right. I don't think that you should be put in that position. And you know what? The thing that's interesting, money will always find a way into something. And there's a reason now why there are concierge doctors. Those are services where patients pay a certain amount of money to have access to a doctor 24/7. So a doctor can have a concierge service and a smaller number of patients, and they pay him or her, and they have access to him for everything. And that's what money affords you.
And also, oh, sorry, you go ahead.
No, and so when those types of arrangements were not around, to my knowledge, when my husband graduated from med school and started seeing patients. But a certain group of people decided we want to have access to a doctor when we want it, and so that's what capitalism is. That particular opportunity was created. And so when I see that happening, and then I see somebody going into a Walgreens to try and get basic care for something, and you can't get that, that should not be happening, in my opinion.
And a problem you're going to run into there is that these programs, Medicaid and Medicare, are run at the federal level. So this is the U.S. Congress and the executive branch would be in charge of putting these kind of policies into place. There's limited things the Missouri state government could do just, you know, in and of itself about how much they pay out with Medicaid and things like that, because that's not really their decision to make. But that just to let you know, that is a federal issue. Any other questions? Oh, we got one in the back.
Do you think there could be any big issues that arise in the near future by expanding this Medicare or Medicaid?
When you say big issues, dude.
Just like problems with like how many people are doing it. Like I know with like the unemployment that we just had, nobody was working because they were getting paid so much. Like, do you think people are just gonna work at cheaper jobs so they can get this free healthcare and get it all paid for?
It'll be interesting as it's rolled out to kind of really see how it plays out. I mean, I think, you can, there are estimates as to how many folks will access it, anywhere from 230 to 275,000 individuals. And once the system is up and running like anything, there are things that happen that have to kind of get ironed out. But in terms of foreseeing any problems, I would hope not. I mean, we're already servicing the most vulnerable. This is just kind of opening up a larger population. And I would imagine that the systems that are in place to deal with individuals that were being serviced on Medicaid, it'll just be a larger population. We'll hire more people. Hopefully the systems will work. I don't know the answer, specifically until we kind of get down the road on that, but I would hope, and there are other states that are doing this. People can, our departments can inquire with other states who are doing the exact same thing and seeing the most efficient services. So there's a lot of ways that they can go about finding the best way to roll this program out. So I'm hopeful that it happens without any, big problems, but time will tell. Time will tell.
Yeah, and with Medicaid, it's important to remember that this isn't giving cash payments to people. Sometimes it's kind of likened to welfare, but it's considerably different. Nobody's getting cash as a result of this. All it does is help cover your medical expenses. And I guess there might be some people who would quit their job because now I'm getting, government subsidized health care, but I actually honestly think that'd be fairly rare for something like that to happen. Yeah, absolutely. My argument would just be, I think it's not a lot of people. I'm not saying there's none, but not a whole lot. Because I have free health care now, I'm not going to have a job. It might happen, but I don't know if it's super likely in a lot of cases.
Well, in this particular program, I think that was one of the myths that was being kind of put forth was these were folks who weren't working and, were just, not working and we're going to claim health care. And in fact, they are working. When I was talking about many of them are, folks who were at fast food restaurants or cleaners or, those kinds of front-facing jobs, interacting with people. And when you see a lot of these hiring signs, I was just reading an article the other day that, many people do not want to put their health at risk. People are still dying from the virus. And so it's easy to say, why are these jobs at all these fast food restaurants or at cleaners or wherever, why aren't those jobs filled right now? And the article was saying that people are really rethinking if they want to put themselves out there in that way and risk getting sick when they're interacting with people who, and this is because of the virus, you may not know if they're vaccinated, if they're not wearing a mask, all these kinds of things, and yet you're having to work in that environment so many hours a day, and then bring that back home. So they're really rethinking, do I want to take that risk? And for many, they're deciding not to do that. So at least for those who are protecting themselves and frontline type workers, this will provide an opportunity that should they get sick, it won't bankrupt them, basically. And that's what's been the concern, is that if they do get sick, where does that money come from? Because then they're going to be in much more dire straits than they already are.
Anybody else have anything they want to ask? No. Okay.
My bad.
Anybody else here? Let's please get a round of applause for the state representative to come out and talk to us.
Thank you.
Thank you so much for coming out. It was a really good discussion. So.
I appreciate the opportunity. Zoom only goes so far.
Yeah.
It's nice to see folks and to have these kind of events. And I was telling Gabe, the different topics that you all are covering, I wish that was happening in communities all across the state, all across our nation. You just hear about it in sound bites on the news. And what really needs to happen is you need to have thoughtful conversations around all these issues. No matter what side of the aisle that you are on. Because without those conversations, we're really not going to solve these, these issues and understand really what they're about. Google is great, but, there are other ways to find out information. So I appreciate this forum.
Thank you very much again. All right, thanks everybody. Have a good rest of your day.
Thank you everyone for being here. We have the Equal Rights Amendment under examination with a panel at 11:30.
Yeah, that'll be fun.
We have election analysis at 1 p.m.